Good morning, everyone. I'm gonna go over the program. So first, this is Affordable Housing Week, and we're doing this event in partnership with the East Bay Housing Organizations. Good. Right. So we have a staff member from EPO who will give us a warm welcome, and then say a few words about Affordable Housing Week. Then we'll move on to get a presentation about housing and some of Walnut Creek's policies and programs from our housing programs manager. Then we'll move on to the panel discussion where every panelist, they'll get up to 5 minutes to talk about themselves, their area of expertise, and the connection to affordable housing in their industry. Then we'll open up for Q&A questions. And after that, we'll close. And I encourage everybody to fill out the survey, and that's in your seat along with your program with a pen. And then also walk around, get food, look at our posters, and on your way out, grab resources. And then return the surveys and the pens. So that's good. So without further ado, I will pass it on to Woody Karp from EPO.
Hi, everybody. Thanks for being here. My name is Woody Karp. I'm a senior project developer for Eden Housing, and I am a board member at East Bay Housing Organization. I've been a EPO board member now for about 2 years, and I have been an affordable housing developer for about 17 years. EPO brings a whole new perspective to the work that I do, which is to help build and maintain high-quality, affordable housing for low-income families, seniors, and people with disabilities. EBHO has been around since 1984 and has worked with all of their members to create, preserve, and protect affordable housing opportunities for low-income communities in the East Bay by advocating, organizing, educating, and building coalitions. We celebrate Affordable Housing Week to call attention to housing affordability crises, to lift up solutions, and to celebrate our achievements. This year, our 22nd Affordable Housing Week, it runs from May 10th through May 20th. By being here, you're joining thousands of people around Alameda and Contra Costa County at 15 events in 9 different cities. There's a poster in the back that has a list of all the events that you could attend. Last night I attended a meeting here in Walnut Creek talking about how we can reach out to our elected officials to advocate for affordable housing, how we can message those elected officials so that they have the tools to help us bring more affordable housing to the community. This is a great segue from that meeting, giving us understanding the resources that are available to us for Affordable Housing Week. So this year's theme is building communities and building power. Communities are healthiest when most powerful when they have high quality affordable homes for everyone. When those that are most affected by the housing crisis can shape their own futures. Thank you to the City of Walnut Creek for putting on this event, for help building communities and power. In today's difficult environment, what you do is more important than ever in advancing social and racial justice, prosperity, and sustainability. Today we celebrate and learn, but after this, let's take action. Some of you may have heard about the statewide Veterans and Affordable Housing Act, a bond measure that is going to be on the ballot this November that would bring $4 billion throughout California to create affordable housing for veterans, for people who are homeless, for low-income families, and even first-time home buyers. It's all in our hands, and it's time for us to all step up. We absolutely need your help, so make sure you get out there, sign petitions, and start working on this campaign. Also, the for housing resources, policy information, and profiles of residents and properties. Pick up the brand new Affordable Housing Guidebook. It's full of really incredible information. Gloria is holding an example of it right back there. Gloria is Executive Director of EPHO. And finally, I invite you to join me as a proud member of EPHO. And you can participate in lots of committees that we have throughout the year to help us advocate for and build more affordable housing communities. So thank you so much. That's it.
All right, thank you, Woody. Yes, that was great. So now I will pass the mic on to our housing programs manager, Margot Ernst, and she's going to give a short presentation about housing and some of the housing policies and programs in the City of Walnut Creek.
Thank you. Thank you, Anne. Good morning, everyone. So I wanted to start this presentation just with a little bit of background, and I'm going to kind of go through this pretty quickly because it's a lot of information that I think people already know, but it sort of sets the foundation for our discussion today. And that's to talk about what is sort of happening locally, regionally, and nationally in housing right now. So this is a map from 2017 that shows the hours needed at minimum wage to be able to afford rent for a one-bedroom apartment. And this is throughout the nation. So the darker the blue, the more number of hours you would need to work per week at minimum wage to be able to afford the average rent. And so you can see California's on there with 92 hours. It's not the highest, but it's close. I think it's fourth. And we'll look at this a little more locally. So 92 hours per week at minimum wage for California. For Contra Costa County, that number is 126 hours. And for Walnut Creek, it's 148 hours. The California Housing Partnership Corporation just came out with a housing needs assessment for a statewide housing needs assessment, and they also have it broken down by county throughout the state. And there's some interesting information and recommendations that came out of that needs assessment, and I'm going to go over just a few of those. And you can access all of the reports on the website at chpc.net. But some of the key findings statewide is that rental apartment demand has dramatically outpaced supply. So renter households is actually increasing and ownership is decreasing. That's nationwide. So more people are renting and fewer people are owning. 1.5 million more affordable rental homes are needed in the state of California. So this shows the gap for extremely low, very low income housing that's affordable to people who are very low and extremely low income. And in Contra Costa County, that number is 31,139 units. Those are units that are affordable at 60% of area median, 50% of area median income and below. Statewide, renters need to earn 3.5 times the minimum wage to afford the median asking rent. So that is similar going back to the earlier slide. And in Contra Costa County, it's a little higher at 43.27. That's what minimum wage would have to be able to afford. Households earning half of median income or less, so this is 50% of AMI or less, are highly rent burdened. So they're spending on average throughout the state 66% of their income on rent, which leaves very little left for all of the other essentials, including transportation, which is a very high cost, health insurance, food, and everything else. And this shows this chart, at the bottom, those stand for extremely low income, very low income, moderate income, and above moderate. So it shows the percent of people in those categories that are what's called severely rent burdened. And severely rent burdened means you're spending more than 50% of your income on rent. Contra Costa County is very similar. 58% are severely rent burdened, and the chart, as you can see, is a very similar percent. Obviously, the lower income people are, the higher the chance that they're severely rent burdened is. So I want to just talk real briefly about some of the reasons for our current circumstance, for the what is oftentimes described as the housing crisis that we're having in the Bay Area and throughout the state. One of them is population growth. So the population has consistently grown throughout California. This is actually just Northern California. And you can see between 1970 and 2015. We also have an increase in the growth in urban areas. So you can see for the population growth in the last 7 years, let me see if this works. Oh, here we go. So this is the urban Bay Area. You can see it has a much higher percent of the state's population growth in the last 7 years than it did in the 7 years before that. We also have, this came from the state of California, the House of Housing and Community Development showed this information about how we are underproducing housing. So obviously with supply and demand here, you can see starting with the housing recession, 2007, through today, so this continues actually today, that we are underproducing housing based on what the projected housing need is. And it's been going on for a lot of years. This is a similar thing showing the permits that are issued in the Bay Area from 1970 through 2015. And you can see it's declining. These are housing permits, and at the same time, population is increasing. This shows the employment growth versus the housing growth. This is statewide, so the blue lines are the new jobs, and the orange-brown line is new housing permits. This shows it for the Bay Area, similar. And another reason there are a lot of factors. So we have supply and demand, we have the population growing, we have fewer housing permits being issued, and then there are a lot of things that go into that. And I'm not going to go into all of those. There might be some other event this week that focuses more on that. But I will just briefly say there's things like the high cost of land. There are barriers to building affordable housing. So high cost of land, the high cost of construction. So construction jobs really took a dip after the housing recession, after the recession and the housing market crash. People left in droves the industry and went into other industries, and it hasn't really recovered. So high demand for construction, not a lot of new people going into that field. And then, of course, there are regulatory barriers to building housing. If you talk to any developer, they will report that there are lots of regulations, lots of policy standards, things that they have to comply with that cause delays, that cost money, that make it hard to get housing built. So, and I could go into so much detail, but I won't right now. So I want to talk a little bit about who's impacted, and I want to just open it up, and you can just popcorn style, anybody can say, like, who do you think are the people who are most impacted? Who or what? So it could be who or what. It could be the environment, it could be low income, so anybody from the audience. Seniors. Service workers. People with disabilities, low income families. Teachers. Any single people? Women? Women? Transitioning youth? Good. So, and some of this is what we're going to be focusing on today. So, I have a list here. It's not exhaustive. There's a lot more that can go on it. But really, who's impacted are people in your community. It's your friends. It's your neighbors. It's your family. And it may be people that you don't know, but it's people that are really important and critical to kind of the life as we live. So we encounter people all the time throughout our life, and whether or not we're impacted by the housing crisis, somebody somewhere is, and it does impact us. We don't always see it. But certainly I have a list here. Obviously, renters and tenants are really impacted by the high housing costs. Lower income households, moderate income households. We have a real sort of decline nationwide in middle income. So the wealth inequality is growing, right? And the middle class is declining. Seniors, people on fixed incomes are really impacted. Communities of color, we still, income inequality still falls along racial lines. So we see lots of impacts with displacement that are affecting communities of color disproportionately. First-time home buyers, and here's a list of ways that they're impacted. So displacement, long commutes, loss of community health consequences. So a lot of the panelists that we have today are coming from certain fields that will be able to talk a little more about what some of the impacts are in their industries and what they're seeing. So what can be done about this and what is being done? So I'm going to talk a little bit about Walnut Creek, but I wanted to just highlight, of course, we hear a lot statewide. There's a lot of initiatives happening, a lot of legislation that gets proposed, that gets passed, that's being discussed. I hear it all the time on the radio when I'm driving into work. So we did have a big housing package that was passed in 2017, but there's been lots of other bills as well. A lot of them are focused on increasing funding, streamlining development, which is really about getting more housing, housing of all types, and also strengthening or enforcing the Housing Accountability Act. And what is the City of Walnut Creek doing? So in the City of Walnut Creek, I've worked here for 15 years. I feel very fortunate that I've worked with many different council members, a lot of different councils, and across the board, we've always had a strong support for affordable housing and strong support for the programs that I administer. So our city council had identified 4 priorities over the past couple years, and one of them is to improve the affordability and availability of housing in Walnut Creek. So that's a very strong commitment from the city council to address this issue and to find solutions. And I just want to invite anybody on city council who's here today to stand up. I think we have one. We have council member Rich Carlston, former mayor. But do we have any others? Because I can't quite see everybody. No. Good. So thank you for being here. So we're working a lot with policies. We have had an inclusionary ordinance for a lot of years. We also have a commercial linkage fee ordinance. One of the without going into a lot of detail, the primary thing this does is it gets us to be able to have affordable housing built, whether it's included in the market rate projects or whether we're building it by subsidizing 100% affordable projects with the in lieu fees. And this is really critical because as much as we need housing to deal with the supply and demand issue, we're always going to need affordable housing, and we need it now more than ever. I wanted to highlight one of our new homeowners in Walnut Creek who purchased a below market rate unit, I think about 6 months ago, sometime in the last year. So she was a Walnut Creek resident. She was living in an apartment building that was being rehabbed. She was at risk of displacement. The rents were being increased. She's low income. And so she was working with a realtor to try to find a place to live. And she was, at that time, I think she was 71 years old. And it was really hard. It was really challenging. And the realtor saw the listing for this below market rate unit that's at 555 YVR. She applied. She was selected to purchase the unit. And she was so thrilled, and I'm really excited to highlight her because one of the things when she purchased the unit, she was so grateful. She said, if there's anything I can do. And so one of the things we said that she could do is we said, you can tell your story and you can come out. And so she's been interviewed, and we'll probably have videos at some point in the future. And she reaches out every once in a while to just let us know how grateful she is. And she's a part-time piano teacher. She also works part-time at an elementary school. And she was at risk of losing her community, and it was really scary. And for the first time in her life, she became a home buyer. So she's a first-time home buyer at 71. So building housing and building affordable housing is something that the City of Walnut Creek is really committed to. Between 2005 and 2017, we've invested $21.6 million into subsidizing 100% affordable projects. This has come from impact fees from former redevelopment agency money, state money, federal sources like CDBG. Some general fund went into that. And so really using our funds to leverage. We have a couple that are upcoming, that are underway. Riviera Family Apartments is just completing construction. It's 58 units. It's near the BART station. These will be leased up soon over the next few months. St. Paul's Commons is having their groundbreaking tomorrow at 10 a.m. You're welcome to come. This is going to be 45 units of very low income housing at the St. Paul's property. And we have a Habitat for Humanity project is currently going through its review. It's got its density bonus use permit, and it just needs final design review approval, and that's going to be for 42 units, home ownership units near the Pleasant Hill BART station. We're also really working to figure out how can we incentivize more affordable housing development. And a lot of this is about partnerships, so collaborating, working with affordable developers and learning and listening and understanding what will it take to incentivize you to be able to include more affordable housing in your project. So this is really important because we want to be partners in this. Everybody can be part of the solution. So we're going to be updating our density bonus ordinance. We're going to be working closely with developers in this process to identify what can we do in terms of our regulation. How can we streamline, for example? So looking at those regulatory barriers, what do they need to be able to make the project quicker to build, more affordable, and therefore be able to include affordable housing? And most importantly, and it's what we're doing here today, is to engage. So the city, we've been working very hard over the last year on an outreach and education campaign that's spearheaded by Ann Wong, who is moderating today. So I just want to give a shout out to her because she's done so much work doing all of our outreach and education. And now Samantha is here helping her. Samantha just started a few weeks ago. So we're so grateful to have the additional help. And to just really encourage community members to engage. One way is you can sign up for our housing information and news on our website. You can also sign our sign-in sheet over here with your email, and we can sign you up. We can sign up for you if you'd like, or you can go to the website and sign up. And we send out lots of information when there's new projects, when there's policies being discussed, when there's events happening. All of that can get out to you. And then, of course, Affordable Housing Week, what we're doing right now. And it's very inspiring. I went to the event last night. I thought it was great. There was a lot of really good information, a lot of strong support. And a lot of the same people who were there last night are here today. And here in the audience, I see lots of people that have supported many of the programs and policies that I work on. And that's one of the best resources that we have is the community. It's the residents. It's people showing up, coming together, getting educated, learning, and figuring out together how to move forward and address what is a critical emerging issue. So that brings us to today with our panel. And so this will conclude my presentation. And I'm going to turn off the projector so you can refer to your program for the schedule for the rest of the events. And I'm going to hand this back over to Anne. There she is.
All right. Thank you, Margot. Yes. So
Figure this out.
Okay. And then the lights are on, right? Okay. Great. All right. So we'll move on to the panel discussion. So panelists, why don't you come up and take a seat here, the panel table. Yes, so first so thank you so much, all of you, for being here today, taking the time and joining us in Affordable Housing Week and in this event. I wanted to introduce everyone, starting from my right and your left. So we have Ozzy Arce. He's the associate planner with the City of Walnut Creek, and he focuses on transportation. And we have Dr. Nellie Meyer. She's the superintendent from Mount Diablo School District. We have Jae Ho, the chief executive officer from the Walnut Creek Chamber of Commerce and Visitors Bureau. We have Stephanie Merrill, director of community health improvement from John Muir Health. And then we have Olivia King, Director of Resident Services from RCD Housing, which is an affordable housing developer. So thank you. Thank you all for being here. I wanted to say panelists, you have up to 5 minutes to talk about yourselves, the work that you do, and really how housing affordability or the lack thereof impacts your field or your industry. And so we'll start. So I want to say Samantha, she'll be around to help you track time if you need to. So other than that, we'll start off with Ozzy. Thank you.
Awesome. Can everyone hear me? All right. Welcome, everyone. My name's Ozzy. Welcome to Walnut Creek City Hall. Thank you for joining us this morning, and thank you for having me. You know, like Ann said, I work here now for the City of Walnut Creek and as associate planner working in transportation policy and planning. What does that mean? That means I help figure out how to move people around the city, how to move people around the region. And note how I said move people and not cars. You know, first, before I get going, and I know I only have 5 minutes, so keep me to that because this could become a snooze fest really fast. And so I got my start in affordable housing. I used to work for a nonprofit developer down in San Diego when I went to grad school. So I work with TCAC, the 4%, 9% allocation. So that's really where I learned affordable housing. So much respect to the housers out there. But really in today's world, in 2018 and in the last few decades, we've learned that we can't separate housing from mobility and housing from transportation. And so while I got my start in affordable housing development, I quickly learned that transportation plays a key role in how we build and how we move around. And so really how we talk about housing and transportation, and really what I want to focus on today, is this context of location efficiency. And it's really the idea and the benefit of being able to live close to work, being able to live close to shops, dining, what I call life in general, location efficiency. And we understand the benefits of that. We've done a lot of the research that tells us that folks that are able to live closer to where they work spend less on transit costs. And what we understand is that the two larger costs that folks have are housing and transportation. And so when we some of the impacts that we see is when we have this concept of drive till you can afford, right? That helps no one. This concept of drive till you can afford really leads to congestion. It makes folks have to drive farther. And we've recently learned, and I don't know how many of you all caught the New York Times article that branded this new concept of the super commuter. Right, and that's not good news for the transportation field. We shouldn't be branding new concepts for folks that are driving further. And don't get me started, obviously I know I only have 5 minutes about the environmental impacts, but really what I want to talk to you today is how do we creatively move folks around in the 21st century, understanding that we can't necessarily build our way out and move this concept of drive till you can afford. And so what that means here in Walnut Creek is what we understand is we have a very suburban platform. And what we know also too is that there are 101 cities here in the Bay Area, but there's not 101 BART stations. And so how can we capitalize on the assets that we do have here in Walnut Creek and how we don't have any necessarily more land to build out? So how can we creatively infill develop near our transit stations? And so I know the theme here is building communities, building power. And so what I would argue is a little modification to that is that building communities that are transit rich also builds power. And so thank you for your time today. I'll try to keep it at that, but happy to answer any questions.
Yeah. Thank you, Ozzy. Yes, and we'll go to Dr. Meyer.
Yes, thank you. very interesting to hear from that different perspective. Hello, everyone. My name is Nellie Meyer, and I'm superintendent in Mount Diablo. And I have over 30 years of experience in education, and it's really changed, especially regarding this particular issue. I can say that with a school district with 32,000 students, that we are definitely looking at the need to recruit and, even more importantly, retain strong employees. And I would have to say that, as Ozzy mentioned, the work that I primarily do, not only the majority, 90% of the budget, but 90% of all of our time is about the people. And it's developing the people, and it's making sure that they're trained and that they're there for the students and coaching. And when you have the transiency that occurs due to housing affordability, it definitely has an impact on our students and communities. I can say that the California School Boards Association, they recently did a survey, and they said they found that 75% of teachers who left the profession said that they would consider coming back if they could afford to live in the area they taught. 75%. And so I just want to say that when I do exit interviews, and it's not just teachers, it's school secretaries, custodians, bus drivers, I ask them, because I pull them in and I go, why are you leaving? And inevitably they say, you know, I had an hour commute from Stockton, and now I have children, or now I want to have that time at home. And really, stronger communities are built by stronger families at home, whatever your family looks like. And so for that reason, the impact of affordable housing has been great on the educational system, and we know that strong schools make strong communities. So lastly, I would just say I loved what you said about collaboration. I went into this to teach economics and psychology. I did not go in to be a housing affordability expert. And so I really look to the partnerships that you all bring to us, because we are educators and not trained in this. And the transportation support and the information that you all have in the room are really what I believe we need to capitalize on. So thank you.
Thank you. And Jay?
Thanks, Nellie. Jae Ho, can you hear me? I had some notes, but I think I'm going to change that. In 1991, I moved here from Minnesota. Didn't want to move here because had been working in economic development and chambers of commerce. California's got a very bad reputation in that world. Crazy people. First of all, housing. How on earth can you have housing prices, on average, higher than two wage earners can pay? It does not work. It doesn't work in the rest of the country. But it seems to work here. So when I moved here, I was I just assumed that it would work out, that we'll figure this thing out. Well, it took 7 years of renting in the Woodlands in the neighborhood to get enough money for down payment to get a house. And even that was on a crazy deal where we were able to get in at minimal. I've got two sons, one of whom cannot afford a house. The other, we've all gotten together and helped them out buy a place in Martinez. Point to that story is it's really personal. It is a big deal. And we talk about affordable housing. To me, that's subsidized housing. We don't have affordable housing. You can't afford to buy a house for $1 million in Walnut Creek in most jobs. So at the Chamber of Commerce, where I come from, we spend our time on the affordability side. How do we get people to earn enough money to live here? Let me tell you, back to California, we've got a bad design here and always have had. We reward sales tax in this community as a perfect example of that. That's great. $2.4 billion economy sounds like $24 million the city has to spend money. But it's generated by businesses that hire minimum wage folks, service industry. We've always neglected the higher end folks. The John Muirs of the world have to work very hard to attract doctors here because that same doc can make the same amount of money in Texas for a third the cost. So our time is spent a great deal on how do we attack the affordability side of this. In the Shadelands, we've been doing a number of things. The Shadelands, you folks who know where that is, has floundered around at 40% vacancy We've just not been able to get people out there because they don't want to drive up and down Ignatia Valley Road. Well, we've done a number of things and gotten that vacancy down to 13%. The important point there is that's not by retail sales, that are, as wonderful as they are, and they just don't generate enough money for someone to live and work here. But there have been Bass Medical, a number of medical and high-paying kinds of jobs. They do, in fact, stimulate our economy, and not artificially, not by taxing from one and give to the other, but in fact by generating the revenue. Any community is a living organism. We are. Any activity in one area will affect the other area. It always does, and there are always unintended consequences. And so I don't want to sound as though I'm discouraging in any of these areas. It would not be our first choice to subsidize one area to pay for another to lower our price, because now you've made that other higher. However, in the real world, we have to do those kind of things. We also have to look at other kind of creative ideas. We've all heard about NIMBYs, not in my backyard. Well, one of the movements I'm seeing in Northern California is in-law houses. They're now called granny houses, where we add a little space in back. So we went from NIMBYs to Grimby's. Granny's in my backyard. Is it the solution for no, but it does, will it add some houses? Yes. One other thing I would point out is we've worked with a number of the developers on virtually all the housing that's come up, whether it be on the county at Saranap or BART and so forth. And I would say this, you know, we're all kind of probably in agreement that we have a supply and demand issue, more demand than there is supply. I'm gonna say that every single one of those projects was reduced in size to get passed. Well, how's that working? So it is, in fact, a living organism. We're all a part of it. And our role in it has been to try to work very hard to help folks get enough employment, get enough earnings to be able to live and contribute here rather than have to live out a long way away and commute. And the final thought there is we're approaching this as a political subdivision of Walnut Creek. We are a part of a bigger range of communities. If we were to compare ourselves to San Francisco has areas that are economic generators, high-end, low-end, et cetera, but it's taken more as a full mechanism. Here, I'm not sure that it's as beneficial for each community to try to solve the full range of issues as much as it would be to create a cooperative basis. That's all I got. Thanks, guys.
Hi, good morning, everyone. I'm Stephanie Merrill with John Muir Health. I'm the Director of Community Health Improvement, and basically what that means is I run the Community Benefit Program for John Muir Health System, which includes all of our outpatient and inpatient units. And I've been in community health for about 30 years, believe it or not, and it's a big passion of mine. I was on the other side of the house for many years in terms of running community health organizations, and I actually was a super commuter because I live in Martinez and I used to commute to San Jose. And the day that it took me 3 hours to get home on a Friday before a 3-day weekend and rain and accidents, took me 3 hours, and I internally just said, I can't spend the rest of my life this way. And so I made a decision to come closer to my community here. And John Muir called me immediately and said, hey, why don't you join us? We're in your backyard. So I've run organizations that really help vulnerable populations, low income, immigrants, seniors, those who are unable, have literacy difficulties, just across the board, homeless, pregnant women without insurance. So I've kind of seen it firsthand. I'm in a really good opportunity right now to really work with our communities and partner with other organizations who help with the vulnerable populations. I do have a handout in the back in terms of our community benefit and John Muir's mission. And I bring this up because what's very important to me is the work that is being done is to serve our community. And the collaboration that Margot mentioned is a big, big deal. In this new world, there's something that they call social determinants of health. In my previous world, it's all the vulnerable populations, but it includes frail and elderly, people who have access issues to any kind of health care, including insurance status, transportation, and housing. So when Ann first called me and said, I'd like you to be on this panel, I said, I'm not a housing expert. And she said, we don't need your housing expertise. What we need is your health expertise. And so I work very closely with our internal departments at John Muir. I work with all of our community partners. And what we're seeing is an increase of medical issues that we're seeing actually in the emergency room more than people receiving preventive care. Part of that is transportation. Part of that is access and questions and fear of any retaliation. Part of that is high deductibles. Part of that is I'm commuting and I got home and my child at 1 o'clock in the morning had an asthma attack and I cannot take the day off or I'll get fired. So I'm gonna go to the ER, get this settled, and then go on with my life. And we're seeing that more and more and more. So I wanted to give you a perspective that the housing industry right now, health stability and health, there's a few ways that it affects everyone. The health, we're seeing it, actually one of our most vulnerable populations are children. More and more children are going to school hungry. More and more children are going to school, their parents are having to work further and further, so they're couch surfing is what we call it. They're staying at friends' homes. And so there's not a stable environment for them. Generally, we're seeing children with increasingly poor health, increase in asthma, low weight, as well as obesity. So if they're not getting if there's food insecurity, then they're not eating nutrition type food, and then they're either gaining weight or they're in areas where there's economic depression and the parks don't have functioning water fountains or toilets, and so they don't go out and play. So that we're seeing that more and more, and developmentally delayed type of symptoms and increased lifetime risk of depression. So we are seeing this in our very, very young children, even at 5 years old. Our health risk for our adults are reduced access to care, and that's everything. It's wellness, postponing needing health care, postponing needing medications, mental distress and difficulty sleeping, and incidents of depression. So we're hearing of people having to delay picking up medications, paying their rent, or eating. And those are the choices people are making on a monthly basis. The longer you go without medication, the sicker you get, and then you end up in the ER. And as a community, that's not good for anyone, including the individual. So I'm here to help answer some of those questions for you, and hopefully we can, as a community, really work together toward this. So thank you for having me, and thank you, Ann.
Good morning. I'm sitting here thinking as I listen to everybody talk a bit about how housing impacts them. And the bottom line is that housing impacts everything, and these folks just shared that. So education, transportation, health, everything is impacted by housing, or the lack of housing, or lack of affordable housing. So I'm Olivia King. I'm the Director of Resident Services for Resources for Community Development, also known as RCD. My role with the organization is that I oversee our resident services. Oftentimes we build housing for folks, we get folks in, and they need some additional support. And so my team is available to provide them with that additional support. It might be they may need some assistance with getting into schools. They may need to figure out, how do I get benefits? How do I figure out transportation? Because oftentimes people are moving to some of our newer communities. So my staff is in place just as a placeholder, just in case people need some additional support. So we provide supportive services to all of our residents. It's on a volunteer basis, but it is available to folks, because oftentimes we're housing people who are right off the street. They haven't lived in housing for several years, so they're having to reacclimate to what does it mean to really live in housing? What does it mean to live within a community? So we want to make sure that we're setting them up to succeed and not setting them up where they're going to end up back on the street. So at RCD, we've been around since about 1984. We have 57 projects right now, and what that means is we develop affordable housing throughout 3 counties. We're actually in 20 different cities, And we are fortunate enough to be able to build right here in Walnut Creek. It was great to see two of our projects up on the screen. Riviera is leasing up right now, and then we have the groundbreaking for St. Paul's tomorrow. So I hope that you all will come back and join us for that. So we have about 2,500 units, but we actually house about 4,500 people. Not only do we work with low-income folks, moderate-income folks, we also serve this population, which we affectionately call the special needs population. And these are folks that may have some sort of mental or physical disability. They may be living with HIV or AIDS. And so we work with them, and in each of our projects, we have these set-aside units so that we're making sure that we have an integrated model. So we're integrating because that's the real world that we live in. And that decreases the stigmatization that comes with housing. As Margot said and other folks have said, the face of homelessness is changing. It's not just folks living with mental illness anymore. It's not just substance abuse folks. It's regular folks. Some of our neighbors, we don't even know that they are suffering their income rent burden because they're doing what they can do to get by. So we really try to build housing that looks amazing so that when you drive by, you're not saying, oh, that's the affordable housing building there. You have no idea unless we actually point it out to you. So one of the buildings that we have in Walnut Creek, which we've had for about 10 years, is Villa. It's a 70-unit senior building, and the idea is that our seniors will be able to age in place. And the senior sites are incredible because the seniors really look out after each other. So if they haven't seen their neighbor in a while, they're gonna go tell the property manager, hey, I haven't seen the neighbor. So there's wellness checks that will happen. And our goal is really to help people live in community. I actually grew up in the Midwest, and I remember you knew your neighbors. And I don't get a sense that here that there's a lot of us that knows our neighbors. And so our role is to really help people build community. And then, as I said earlier, some folks are moving from other areas into better locations because they know that housing is available there. And then the last thing I wanted to really point out was about the need. So last year, a year before, we developed a 32-unit building in the city of Alameda. We had 12,000 applicants apply for that. And just with the Riviera, there's 57 units. We actually had 5,000 applicants. So that speaks to the need. We always say we cannot build it fast enough for folks. So I was asked, like, why do we do this work? At RCD, our mission is to create and preserve affordable housing for those with the fewest options.
Thank you. Thank you so much, everyone. That was great. Now I think we can go on to the Q&A. And I forgot to say that for the Q&A session, if you have any questions for during Margot's presentation, or if you want to expand on something that she said, she's also available and she can answer too, along with the panelists. So.
This is a question for Olivia. What do you deem as the largest roadblocks to getting housing built?
Yeah, it's what Margot was saying, all of those obstacles that she didn't bother to go into. I'm not on that end of things. I'm on the services side, but I am often a part of conversations. And as an example, we've probably been having conversation about Riviera and St. Paul's for many years. And there's just lots of different things. So what we have to do is figure out what's the right funding source. Like, it's really expensive. So we may start off with the building looking a certain way, and then you realize, well, it's gonna be too expensive to do it just this way. So now we gotta go out and find other funding streams that can help support that. Our building in Berkeley, Oxford Plaza, it took us 7 years to get that built. Some of that was not in my backyard, you know, and Berkeley is very progressive, but you get a lot of pushback. And so you have to have these community meetings, you gotta get buy-in from the new communities that you're moving into. So there's lots of different barriers to that. And so I think there's policies that need to be put in place so it doesn't take us 7 years to build a 57-unit property. But there's a lot of red tape that you have to get through. And I think the cost, I think Margot mentioned construction costs. Like, we're always having to reshuffle because things are so expensive.
Okay, so I'll go here.
Yeah, my wife and I were very lucky. So we bought our house more than 20 years ago, and we've got a lot of equity in it. Okay, it's just sitting there, and I'm at the age where I can do a reverse mortgage, so I could liquidate that money, but we don't need to do that. There's a lot of people sitting out there with a lot of equity just sitting there, and I don't see any bankers up there, so I'm not sure who could help here, but why couldn't there be an affordable housing fund developed somehow by using all the equities out there that people might be willing to share?
Margot, you want to tackle that? That's not my expertise.
Is there anybody from EBHO who can address that? I mean, it's an innovative idea, and we are looking. I mean, one of the things that we are going to be looking at in the near future is whether or not to establish a housing trust fund, what that would look like, if we'd be able to open it up to resources outside of the city. And so that's like, I'm going to put that in my back pocket as something to ask about, how to tap into the sort of latent equity that's out there. And it's true. It's like when we have this sort of escalating housing costs, you know, it kind of creates this big divide, this big river of divide, because you have people on one side who are accumulating a lot of wealth and equity through it, and people on the other side who just can't like jump across that river, right? It's getting wider and wider. And to get that, I mean, when you were talking about the down payments, renting for 7 years, renters can't, you know, if you're in the service industry or you're just working at anything that's not a super high paying job, you can't save for a down payment now because the rent is so high. So housing costs and rent are going up concurrently, right? So you're spending everything on rent. You can't really save for the down payment, which now might be $120,000 that you need, right? Not $20,000. So how to tap into that equity? I think that's a great comment and suggestion, and I have no idea, but I'll put it in my pocket.
Hi, I'm Gloria Bruce with East Bay Housing Organizations, I'm the executive director there. I do not have an answer to that question, but I wanted to chime in because, first of all, I like that kind of thinking. It's really, really interesting. So I'm like looking at my policy director, Jeff Levin, like, do you have any ideas? So we should look at that more. But the comment I wanted to add to that is just sort of in general how I think we are at the point where we do have to start thinking about the nature of home ownership and housing differently, and looking at how can we better use the assets that that we have out there. And so there was a panel either last year or the year before in Walnut Creek about shared housing as another way that, especially if there are adults who are getting older, who maybe own a home, but it's getting kind of big for them because they're empty nesters, or there's, you know, a lot of like property taxes, other things they're carrying, that actually looking at sharing that housing, or maybe even doing what's called a junior accessory dwelling unit. Don't worry about that, but it's basically sort of building an apartment within your existing home. And I know Walnut Creek has looked at ways to facilitate that. So I think just sort of looking at, are there different ways that we can use the homes that we have now? So appreciate that.
You know, the unemployment rate is around 3.9%, which is the lowest it's been in about 15 years. It seems like this would be an excellent time to raise the minimum wage. I guess there's a federal minimum wage, a state minimum wage. I don't know if any other jurisdictions can have a minimum wage, but that would help affordable people more likely to afford housing close to where they're working. Anybody have a answer?
Minimum wage is an approach. It is not that artificial. Let's create a number and see what happens. There's fallout whenever everywhere we've seen that from Seattle to San Francisco to elsewhere. So it would be something certainly worth considering, but guaranteed there would be a fallout from it. At the Chamber of Commerce, the Board of Directors, I know a lot of people don't want to hear it, but it's time to take a look at Measure A. Measure A is a height limit on development in Walnut Creek. Because of the lower height limit, it changes the dynamics of much of the construction that takes place out here. We haven't had an office building built in Walnut Creek since the 90s. And that's where folks go to be employed to afford things. When your kids come home from college, do they aspire to work at Macy's? I don't think so. Do they aspire to work at John Muir? Absolutely. There's a career there. We're lacking in the ability to provide careers that have economic opportunities so that you can now afford the things that need to take place. The concept of taking from one to subsidize the other, it's been around a long time in California, will probably never go away, but it does have unintended consequences.
I would just speak on behalf of governmental agencies. When you mentioned, Jay, that doctors in the Midwest can make about the same as they would here in California, we do have the same thing with teachers, with principals, with others. And so when we have a finite pot, it really kind of turns us on ourselves a little bit, you know. So within districts, we're competing to have the highest salaries, and it kind of goes up and down. And so, if the wages in our industry was increased, then we would definitely see a shortage in another place. So I think there has to be a reconsideration of the government support or some way of looking at wages for California that are different. And just a plug, we're 41st and sometimes 45th in the nation of funding education.
So speaking of doctors, John Muir started a residency program last year. So we had our first set of residents come in, and we partnered with UCSF. So I've worked very closely with all 8 of those residents and with our residency program. We are now, our next class is coming in, another 8 residents. Working very closely with them. These are really, really great physicians. I would go to them myself and would recommend them. And they've all told me, we want to stay here. And they're very community oriented. They work with seniors and all vulnerable populations. But they said, we can't afford to stay here. And they're physicians. So we are looking at John Muir to be creative about how can we help with the housing, because we need more primary care doctors in this area. And some of them are bilingual, so they can go to the Midwest, get paid similar salary, and be able to live in an affordable environment. Here, they could not even afford living in the outskirts of any of the 9 Bay Area counties. And these are the physicians of the organization and the physicians of the future. So because we do have this residency program, it's something that John Muir Health is looking to see what can we do creatively to help with our doctors who are coming here for their final training and who want to stay, because we've invested a lot in them and they've invested a lot with us. And so even for the higher paying career positions, we are finding it to be a problem.
Just to supplement that, there's a new study out that shows the value of a doctor to your community. And let me tell you, it's outstanding. The amount of support we should be giving to John Muir, to Kaiser, to Bass, to Children's, to all the hospitals is nearly unlimited. In the world of economic development, you don't get any better than that. If we add a restaurant to Walnut Creek, we'll have a restaurateur who will probably do reasonably well, a number of management folks, but working your way down, there'll be a handful of jobs, the majority of which will be the low end of the pay scale. Add one doctor and watch what happens, because that doctors have to be supported by a number of folks. There's technology, there's a whole bunch of stuff goes on, and the economy takes a tremendous jump because of that. And it's frankly, it's been an area that in Walnut Creek we have neglected for a long time. It generates traffic, for crying out loud, going up and down Ignacio Valley Road, and we can't have that. Well, we have to have some trade-offs here. We've got to support these huge, huge racehorses we have in our community. We're so fortunate to have the amount, the quality, and the range of medical services. And if we're going to put some money that will have a return, that's the bet to put it on.
The importance of affordable housing is clear, and my comments go more generally towards new residential housing overall. But there's another crisis that shouldn't be overlooked, and that's the crisis of traffic and gridlock. A recent poll commissioned by the Bay Area News Group found that 52% of Bay Area residents oppose more housing if it adds more commuters to the roads and transit systems, and 58% oppose more housing if it makes their commute worse. It should be obvious, but traffic and gridlock is not just an annoyance or an inconvenience. It means people being separated from their families for longer hours during the day, leaving for work earlier, leaving their homes and families earlier, and coming back to their homes and families later. What proposals are there to assure that residents in housing built near mass transit actually use that mass transit for commuting? So that was my question, and I also wanted to add that some of the commercial development that Jae Ho has spoken to, and I live near the Shadelands, and I've been very happy to see that there's been an increase in commercial development there. One, because it brings jobs to Walnut Creek, and secondly, because development in the Shadelands is, for commuters who are working there, they're going opposite of the way that the traffic patterns are, and that's a good thing. It's promoting economic growth in the city, and at the same time, it's not generally contributing to the crisis of traffic and gridlock. But again, my basic question is, what assurances are there that residents in housing built near mass transit actually use that mass transit for commuting?
I could give you an answer to that. First of all, the traffic, how many are one in a car? How many are two in a car? How many? The whole traffic congestion issue relates to how many people are in those vehicles. So that would be an approach to be tackling that. There really is no guarantee or assurance that if you produce housing near a mass transit, that it'll be used. However, that's been the experience around the country. And if you look at the Pleasant Hill BART area, that's sort of the poster child of smart growth, where you have a variety of mass transit available there, as well as a certain amount of commercial development. To match that jobs housing balance isn't easy, but it is a step in the right direction. And then finally, with something like Shadelands, where we've been able to increase the occupancy, get more employers in there, the next step is, what do we do about those people to and from? So we've got a free shuttle now. We're up to, 100,000 riders a year on a free shuttle from BART to Shadelands. That takes how many folks off the road? That much, and how much carbon dioxide out of the air. In addition to that, we've gone the next step with the Lime bikes. You're seeing those all over. Well, the first 3 months, 7,000 rides averaging 1.5 miles. That is, in fact, somebody who didn't get in the car and go. There are other things we can do. The consideration came up here about, I'm at work and something happened to my child. I've commuted in by BART, by bus, and so forth. How do I deal with that? Well, maybe there are things we can do to have childcare in Shadelands, to have some of those ancillary activities. There will be established a new urgent care facility. So there are things going on that will discourage folks from getting in that car. Part of it is exactly what you're saying, is building around transit nodes. That seems to be very attractive across the country. And I think those are all steps perhaps in the right direction.
Jay, we're going to want to hire you here in the city if you keep taking my spiel here. It's that concept of the chicken and the egg. Is there a proposal that mandates folks? No. But from a city standpoint, we can promote programs that encourage folks to leave their car at home or not purchase a car in general. Jay mentioned, for example, the Lime bike concept, which is a bike share. And so the city is providing this, or is partnering with Lime Bike. It's not a city program. It's partnering with Lime Bike to bring these bike share program to the city. Another example of what we're doing here is providing, we got a grant from CCTA to bring new shelters here in our downtown. I know, shelters, the most exciting topic, but really what it's about, it's providing those facilities. And so the discussion is, do we wait for the ridership, or do we wait for folks who want bikes? Or is it up to the city to provide these programs, to provide these facilities, to encourage folks to do it? And I think it's the latter. How can the city work with our partners out at Shadelands to provide these? How can the city work with County Connection, our bus operator, to provide the free shuttle downtown, which is the most popular route in all of County Connection? Ideally, I'd like to see those times go down from 15 minutes maybe to 10 to maybe even 5, to where you see these so often that you're like, why am I driving? So really, it's that concept of the chicken and the egg. Is should the city be providing these facilities? And the answer is yes, right? How can we encourage folks to leave their car at home? Another strategy, and the last thing I'll bug you with here, is the concept of transportation demand management, TDM. Where we're talking about moving people in a creative way. For example, the Lime Bike. The bike share program is a TDM effort. Another TDM effort that we could move forward with, and I know a lot of projects like Riviera have TDM plans that are specific to that development, that, for example, provide a subsidized BART transit ticket, or a subsidized bike share program, or a subsidized car share program on the site, so folks don't have to buy a car. Another strategic way of encouraging folks to take alternative modes of transportation is by, for example, requiring new development to have a certain amount of bicycle parking. That encourages, again, folks to provide those facilities on site. We can talk about parking requirements and parking ratios all day as well. And so now the discussion is, how much parking should cities be providing or required to provide from these developers? And is there a way to design these development projects to be more affordable by not requiring as much parking? And so while there may not be direct proposals or mandates, right, there are strategies that we can use, either programmatic or policy-based, that get to that same result, and encouraging folks to leave their car at home.
I think that's a really good question, because we struggle with that all the time, because there's requirements as to how many parking spaces you can actually have at certain projects. And I'm not sure that some of our lower income families are taking advantage of the transit that are right in their immediate area. Because the last few buildings that we've developed, they've been in these transit-oriented areas for that reason. However, the reality of it is some of these families are quite large, and so it doesn't work for them to not necessarily have a car. And oftentimes, when they have to go to the grocery store, or they have to do certain things with their kids who are going to school all over the place, it doesn't really work for them to live in these areas. The concept, I think, is amazing, and we're all for that, but it doesn't often work. The other thing that we run into is as the kids age, they may move in with one car, but as the kids age, they decide they're going to go away to college. Maybe they need to drive to college. Now they've had to purchase another car. Then often we see our families parking on the street in the evening after the meters are no longer, enforced. I get it, but there's no way for us to guarantee that it's going to reduce the amount of cars that people have to have, particularly if they're not able to work where they live. That's where the problem is. If we build developments and people can work right where they live, then they can walk, they can ride bikes. But if you're living in Bay Point and you're commuting to Oakland, or you're commuting to San Francisco, because that's where the higher paying jobs are, you have to have a car for some of those things. But it's a good question, and our development team struggle with it all the time.
Thank you.
I would offer that one thing that hasn't really been tapped into in the way it should is a partnership between schools and the cities around transportation. And too often, I would say, school districts, we kind of consider ourselves, the big behemoths. We come first, and we put 30,000 cars out there in the morning at the same time on the surface streets. And so one thing that has come up a lot in our conversations with cities has been the fact that if we could kind of partner to think of more strategic ways to stagger our times, which of course has a lot of pushback from those with a schedule, but also maybe to look at shuttles and different kinds of ways that we could have some of our students looking at public transportation, have our parents looking at transportation, and those parents, they're dropping their kids off and then they're starting their commute. So we see it, and you probably notice on a day when school is not in session, do you ever drive and go, wait, what happened? There's no traffic today. And so that exactly is something that I think that too long we have ignored that, and we really need to kind of plop that variable in the conversation.
Okay, thank you. And then we have a few questions here that we'll take turns. And
thank you. I just had a whole bunch of comments because people have all these ideas. But when I first moved to this area, we had school buses. So parents didn't have to all drive at the same time. And a BART ticket to San Francisco was $2.80, and it's not anymore. Anyway, that's besides the point. But maybe maybe we can partner with, why doesn't BART have a sliding fee scale? Why don't school districts have transportation anymore? I'm sure parents would be grateful for that. Anyway, I'm with COVIA, formerly Episcopal Senior Communities, and I just wanted to put a plug. Thank you, Gloria, already gave me a pre-plug on our home share program. So we do match up older adults who have spare rooms to people who are looking for affordable housing now and can't wait for 7 years. It's ideal for medical assistants at John Muir. It's ideal for low-wage workers working at Macy's. It's ideal for starting out teachers. So any of you panelists who are looking to plug into us and partner with us and try and open up those opportunities now for people, we're here for you, and we'd love to spread the program into Walnut Creek. I did also want to ask a question, though, to the Chamber of Commerce, and I love your concept of a regionalized approach, because while Walnut Creek is doing a really fantastic job, and we all appreciate and can applaud Walnut Creek, how can that expertise and how can those policies and strategies that Walnut Creek is able to do be regionalized? Because I'm pretty sure the city of Pittsburgh cannot do the same thing. And how do we then maybe put chambers of commerce together, put cities together, so that you're sharing best practices with cities that may not have the expertise or maybe not have the same commercial viability to make affordability happen? And population increase is out in East County. It's not necessarily infill in Walnut Creek, and if we'd like to keep people in Walnut Creek, I would like to get people off the roads. Sure, it would help my commute, but how do we also have a regional approach?
I think ABAG, the Association of Area Governments, Metropolitan Transportation, I think the governments are tending to do that better, I think, than chambers of commerce. We tend to be kind of a bit more independent, and they're sort of working on those and taking the lead, and we're partnering. A concept, does everybody know what I'm talking about when we talk about the Shadelands? Okay. A concept there that I think is very good, and that is you're not paying a nickel for the things they're doing. What they did was they formed a business improvement district, meaning we went around each of the businesses and said, hey, could you contribute X dollars based on your property values so we could have some money to do these things, to get the line bikes, to get the things we're getting done. They said, yeah, let's give it a shot. And that's where the funding for all this has happened. So that's kind of an important concept, because that's a principle to a lot of businesses and a lot of chambers of commerce is let's not tax and spend. Let's figure out ways to do it that perhaps are investments by the people who have a return on them. So I think the answer to your question, which I obviously got off track on, is being led, I think, more by municipalities.
Yeah, so a lot of those efforts, regionally we have the Association of Bay Area Governments, but you're in a sense you're preaching to the choir here. My undergrad was in community and regional development, so we quickly learned that congestion, air quality, water, those things are not, they don't respect city limits. You know, those things expand. And so, at least from the transportation planning world, when we're thinking about bringing a new program into the city, again, for example, Line Bike, we make sure that we coordinate with our regional cities to ensure that they know what's happening, because you know that Line Bike could easily appear in Pleasant Hill or in Concord or whatnot. And so, how do we make sure that our visions are in line? And if a jurisdiction is moving in a different direction, how can we work with them to make sure that our program doesn't necessarily impact their community? And so, just having those conversations. Luckily, too, we're able to, we have a representative here in the city that sits on Caltrans District 4 Bicycle Advisory Committee. And so going out and meeting with regional stakeholders, folks from other jurisdictions here in the Bay Area, District 4 covers the 9 counties here in the Bay, and having those conversations from a regional level and even saying, hey, have you heard of Line Bike? Have you seen what they did with the scooters in San Francisco? So just having that conversation to bring those programs and helping facilitate the success of those programs from a city standpoint, because we all want to encourage bicycling as a viable form of transportation.
Well, I'm thinking of how you've been able to put a lot of affordable housing in Walnut Creek, and how can you share that with other communities who, maybe don't have the ability, or, I mean, I don't know why, but when you talk about funding, and I'm not a housing expert, but when you talk about inclusionary, when you talk about, impact fees, other cities surrounding us and in the whole county, maybe need to get on board and do the same thing. I mean, if you've been able to put millions of dollars into affordable housing, how can we take those best practices and spread them to the rest of the county, I guess?
So I think, in fairness, I think they are. I think Concord's done a number of things. For years, I would go down to Heather Farm and play basketball with the guys down there. And they're mostly made up of the folks, Latinos, and folks that are working a lot of the night jobs. Every one of them live in Concord and Martinez and elsewhere. I don't think any of them live in Walnut Creek. In Walnut Creek, we used to, over by the Riviera Apartments, we used to have a house over there that 3 families rented. One got it for the first 8 hours, next got it for the next 8 hours, next got it for the next 8 hours. That's the kind of lifestyle you would lead here. However, our hotels, who have a lot of entry-level jobs, aren't really having too big a problem filling those jobs. The restaurants are. The restaurants are now starting to get pinched in terms of we can't fill those dishwasher kinds of jobs. The bigger picture of the Martinez of the world, the Concord and so forth, they are all working very hard at it, I believe. We just had a mayor's conference last week, and they spoke to this issue. Each of them understands the issue. Each of them knows that they have different challenges and strengths, and I think they are coming together. It's a matter of us understanding what the others are doing.
I wanted to add, too, to that. Walnut Creek, we were fortunate. We had an inclusionary ordinance in place, and we had a nexus study. There were some issues with inclusionary rental housing, and we had a nexus study that supported us in being able to collect fees. And we had a lot of development during a time when a lot of our neighboring jurisdictions didn't have the same level of development, and we generated a lot of fees. So we were fortunate in that way. Every jurisdiction is different. As Jay was saying, there's different strengths. And so not every jurisdiction can implement successfully the fees that we have and still maintain the same interest in developing in the community. It just depends on what aspects the community has that are desirable for development. And so we really were fortunate. We were able to leverage those fees to be able to get a lot of other money. I think one of the things that would be really, really great regionally for this county is to have an affordable housing bond that can get on the ballot, that can get passed, that can get the support of the 67% or whatever it is, 64% that we need. What do we need to do it? 66%, yeah. So if we can get that would be a huge boost to the entire Contra Costa County, because Alameda, other counties have passed affordable housing bonds, and that really, this was mentioned last night at the panel, that really puts us at a disadvantage in terms of being able to leverage that bond revenue in Alameda County. And in San Mateo County is going to really help them to be able to leverage that money to get tax credits. and other funding sources that are going to be coming through the state. So if we can do something like that, that's a real regional approach that would get money into all of the jurisdictions.
And just for the record, RCD is in 20 counties, 20 cities in Contra Costa County. We go as deep as Antioch. So it's out there. We're definitely, but like you said, we do have the bond in Alameda and then also in San Mateo County. So it's making a big difference. So
Just as
In Concord too, RCD's got a project coming up next week. So there is a
Yeah.
housing project, affordable housing project in Concord that RCD is working with. Concord's got $14 million right now to distribute to affordable housing.
Just as a note, we also work in all of Contra Costa, and Supervisor Diane Burgess is putting together an infrastructure group for nonprofits in East County, because the other thing we're finding is that as more housing is coming up there, they don't have the infrastructure that Central County or even West County does. So they're trying to build up that infrastructure, and they're looking for really small nonprofits that need that training and providing that training with support of the local community. So there are a lot of initiatives out there to help rebuild or build up that infrastructure throughout East County, because that's where most of the housing is being built at this point in time.
And I would just comment that there are a lot of people who are on the cusp of receiving affordable housing. A teacher who makes $72,000 a year on average may not qualify. So we have to consider what kind of sliding scale perhaps do we need as a region to really attract the professions that are most impactful on our community.
The one thing I do want to say that John Muir has, I'm not sure if you've seen it, but we have a mobile unit. We have a medical mobile unit, and we also run a Ronald McDonald charity dental unit for children. So we don't want anybody to come to us. We go to them. And we are adding with our residency program 4 more hours starting in July to East County, so that we cut down on the congestion and we park in a central place, and then people in that community can just walk over to see us. And that's something we're going to build out even more as our new van comes next year. So.
Okay. Thank you, Stephanie. Thank you. Are there any more questions?
It's exciting.
We heard some comments about the impact of the housing crisis on homelessness, impacts on the schools, on the healthcare system, and also the changing face of homelessness in our communities. Could we get some more detail or anecdotal comments about that, and maybe some solutions, but more just to understand what's happening with the changing nature of homelessness?
Yeah, I did take some notes. One of the things that I thought was really interesting was, and I think that maybe Nellie had mentioned about the impact of students, and I'd read a statistic that in the 9 Bay Area counties that there are about 15,000 homeless students. And the Department of Education defines homelessness as meaning living in a car, hotel, campsite, shelter, or street, or doubled up with other families due to financial hardship. And in the Bay Area, most children are doubled up with families, and hundreds of homeless children are in shelters in San Francisco. And they think that that number is underreported for a number of reasons, fear being the main one. And one of the things also they indicate is that parents report to school whether their family is homeless, and they have plenty of reasons not to admit it. And one of it is around fear and deportation. So that's a really concerning number of the amount of kids who are impacted, the amount of stress that they're under, to get to school. And so we wonder why they're not performing, or they can't sit still in their seats, because we don't know where they slept, the night before. And actually down in San Jose, which we're currently doing a project there, they've set up these parking lots where families who are homeless can actually go to these parking lots, and it's their community. They live in their cars, but it's a safe place for families to be able to get to. And then we talked earlier about seniors, and the way that the homeless burden is impacting seniors is that seniors, they want to age in place. They want to be able to stay in their local communities. And as we saw with the person up here, she was able to stay in her community. But for a lot of seniors, they can't do that because maybe their health begins to decline and they can't live alone anymore, and it's too expensive to get to a assisted living place. So that's another number that's really growing. And I actually live in Oakland, and I don't know if other folks live there and have witnessed the amount of encampments and tent cities and stuff, but you know, we're really working hard to shift some of that. Right now, we have a building that's in construction, 67 units of just veterans, you know, and a lot of our veterans, unfortunately, have a lot of mental health challenges. So once we house them, we have to surround them with the right amount of supportive services, because we don't want them to end back in the street. So we partner with the VA. We partner with a lot of service partners who have expertise with working with mental health or people with mental health challenges. So those are really some of the things that are popping up right now. You know, like somebody mentioned, there's a lot of money available for veterans now. And, you know, it's finding locations to build is so incredibly challenging, you know, and I think you mentioned that you can't build up, like you can only go so high. So where there's 57 units, the lot, if we were allowed to go up, we could probably house more people, but there's all these restrictions based on, you know, the cities and stuff, so.
Thank you.
I would just add that the new face of homelessness is young. It's a child.
Yeah, the Tay.
And so there's been a great increase in children who are now homeless. We have a little under 200, but very underreported. At a graduation last year, the valedictorian of one of our high schools said she was homeless, and no one knew in 4 years. She studied in McDonald's. She went from house to house. And so it really is a hidden epidemic.
Thank you.
And
Yeah.
we're finding them younger and younger. So we've been working with the Bay Area Regional Health Inequities Initiative, and we just had a session a couple of weeks ago regarding children 0 to 5, children that have not even entered school and are considered homeless. And of course, their health issues are pretty significant, but the biggest thing that they deal with is the food insecurity. So when you don't know if you're going to eat, and it's 0 to 5, and they're not in school, it's setting them up not for success. And so we have some statistics, and that organization has asked us, on the executive committee for the Healthy and Active Before 5, and we are starting to see that as a trend in California. And so, as heartbreaking as that is, we are also hearing from different school districts throughout the Bay Area that more and more children are coming to school hungry. And some of the school districts receive extra funding if they're over a certain percentage of reduced lunches, and they get extra state money. Some school districts are not receiving that money and are trying to fund that on their own, and because they don't receive that state money. And so we're finding pockets of Walnut Creek, Benicia, places that historically did not have that face of children going hungry. And I think it's startling to people when they realize that there are homeless children in this community. And we are walking by them every day not knowing what they're going through. So I just want to point out that you know, Nellie's correct, that it's the face of the new homeless are the children.
Thank you. And I think we have a question back.
Yeah. So it seems to me that that there's not an issue of affordable housing and the need for it. My statement, I guess, is why didn't we think about this previously in the last few years when Walnut Creek was developing the other apartments and things that are now at like $2,800, $3,000, you know, a month versus getting more affordable housing. As we put those in, maybe this was something we should have been considering back then. All of that said, when thinking about kind of the different options of transportation and all of these creative solutions, you mentioned Lime bikes, and it continues to come up as a point. I think you quoted some statistics. When thinking about what that is, you gave a number of them. how do we know that that's actually hitting the mark of what we're actually intending it for? What portion, and the devil's in the details, what portion is recreational use? Somebody just, instead of using their own bike, they're like, let me just go actually use this Lime bike, looks really cool, first ride is free, just down the street from my house, I don't have to buy a bicycle. Great. What's recreational versus what's actually taking somebody off the road? Those are very different things, and those are very different statistics. So when you quote statistics here, it sounds great, but in reality, we don't know what those differences are. So are we actually taking somebody off the road, I guess is the question. And the answer is maybe not. Maybe that was just all of those rides were just those initial rides, and they're just for recreation to see how cool this is or not. And the ridership isn't actually going to continue. So that's one piece. So I want to know a little bit more about that. The second is when thinking about working in the area in which you live, the role and the type of job that you have, there's an assumption that you can find that job here. So if there's a software engineer and they want to work at Google, Google is not in Walnut Creek. Facebook is not in Walnut Creek. There are a number of organizations that are not in Walnut Creek, and somebody wants to work there. How do you incentivize, or is there an opportunity to incentivize those organizations to come out here, to actually bring the jobs that people want that are actually those, because otherwise you are going to get those super commuters, right? So where is that? Where is that in this plan? Because I think we're missing a big piece if you're suggesting that people want to work where they live. The reality is you can't necessarily find the job that you actually have gone to school for in the community that you're living in. So you're missing a big opportunity here, and you're making some assumptions that people are just going to want to work at the store down the street and do all of these things and work in the school district and do all of this stuff. Like, you're making a lot of assumptions that I think are not valid when in reality they want these higher paying jobs. Well, the reason they commute to them is because they want to work at that specific company. It's like the cool new sexy, like whatever it might be. So where's that piece of it to actually bringing the types of jobs that people want to a community such as this versus building? And that's where we're also going to get more revenue versus building a house where we're actually reducing our revenue stream. And then to the same point, like for teachers, like, and I think you kind of also mentioned it, Olivia, like there's a double-edged sword. So you're saying you want to have this affordable housing and bring people so they have access. The problem is with that is that you're also then overcrowding the places in which you're actually not providing additional resources. So WCI has, 1,100 kids that go there. Are you going to put a second story? Are you going to make a developer now who's building all these things, redevelop that whole school? Like, that's an option, but is that the feasible option? Where are we going to build a new school in order to accommodate all of these children that we say that are going to be there and the families? Because there's no, if you're going to build something else, where are the resources? Where are the parks? Where are those things that are actually, you're letting the developers buy them out?
Okay,
Like,
so
those
that's a number of questions that they remember all of that stuff. Yeah,
I
so.
think there's questions that several of you can answer, and I just want to make sure those questions don't get lost and that the panel can still remember. So if you want to go ahead.
Well, that was a lot of questions, but I would suggest if you're going to go bass fishing, you go to a pond that has bass. Meaning, yeah, Google's not here, those are not here, and they never will be unless you have an opportunity for them. We don't have an opportunity now. We don't have a building that can hold anyone. So that's kind of a moot discussion. If you build it, they will come is a bit of a leap of faith. You're absolutely right. We don't always know the outcome. It's not always a direct linear activity. When we put Lime bikes in Shadelands, we aren't checking to see who gets on or who gets off. It's an assumption. And absolutely there will be joy rides as long with, in addition to commute rides. If they're not there, I can guarantee none will be commute. So the point is, to some degree, you have to try some things and take a bid on good faith. We're early in the curve. It's only been a little less than about 3 months with Lime Bike, so we're getting that data in to try to find out how are we hitting that mark. And it's okay to have both going on. The questions you had relative to congestion and so forth is absolutely right. If you want to work at Google, you will be transferring quite a ways back and forth. There are alternatives to Google and Facebook. A lot of those unknown kinds of companies out there, well, in the world of economic development, those are the ones you would like to attract. And part of that is done in today's world what's called a sense of place. If you can create an appropriate place, entrepreneurial spirits will go there. And you can see this around the country. We can go offline with that without making it a bigger statement. But if you go to anywhere from MIT to Boulder, Colorado, to Seattle, this is in fact working. So I guess my response would be, you're right, we don't have a one-to-one linear relationship for those things we're doing, but I gotta think that it's better to try and rather than not. And therefore, from the transportation to the ability to attract employers, better to try and fail than not try at all.
I'd like to speak to that from an organization that actually does have people that want to work at John Muir and would like to live close to where they work, and our higher paid, our residents, for instance, our physicians who in a year and a half will be ready to, they'd like to join John Muir, but for housing reasons are considering not staying in the area. And that's a huge loss because it affects everything around it. So speaking from an employer that's already here and has jobs and needs these positions filled and wants to work in the community globally, I think is where I'm speaking from. That's our challenge. And Google has their challenge, but bringing them here may not be the answer, because then housing will increase even more. Just like in San Jose, there was a burned out building that sold for $1 million, and because of the piece of land that it was on. So it's a give and take, but from a perspective of an employer that is here, and we have a lot of different jobs in our organization, from service jobs to professional, recruiting is really, really difficult. And this is a hospital setting. I know for our community-based organizations that pay much less than our hospital systems, they're having difficulty in recruiting as well, even with loan forgiveness. So it's affecting it in a negative way, and I think what we're trying to do is look and see how we can come together as a community and help each other so that we can build that community to allow that to happen. And there are solutions that are out there. So Google, they have, Stanford, I think, has huge buses that come and pick up super commuters, so it takes people off the freeway. So people are being very innovative about it, but it is an issue. But again, I guess I'm just saying, from people that want to work here and say they want to work here and have a job here, may not be able to stay here. And what we're looking is how can we help incentivize that?
And when we are leasing up our buildings in our marketing plan, we do have local preferences. So we try to house people who are already living in the community, but maybe they're rent burden. So that's, a lot of cities require us to have local preferences so that we start with the immediate community and then we can branch out. But yes, when you bring people into communities, it begins to impact a lot of different things, sometimes positively and sometimes negatively. If you already have a school that's already impacted and we bring in more students. But hopefully folks who are getting in those buildings already live in the existing areas, and that way they get to stay in their community. So that's kind of the goal with the local preferences.
I would agree with that if you overbuild in that area, then we will have schools that are overcrowded. So we have to look at the impacts as they go down the line. I would just share that in 2016, Governor Brown passed a Teacher Housing Act to address this. So I think there's a lot to learn from other districts who have come before us, or other areas. Santa Clara, San Mateo, San Francisco, they have looked at this issue and they are building teacher housing. And it's not a lot. It may be, in a district of 6,000 employees, it's 100 units. But these are the people who are the new teachers or the new employees that you want to bring into your community and retain and recruit. Many of our veteran employees, they benefited from a previous economy. They have a spouse who has a job at Google or something that allows them to sustain themselves. And so bringing people into the profession in all aspects of education is so important. And so this is one way of looking at some kind of compensation in a finite compensation mode of California.
Okay, so all right,
And I'd like to speak to that. Great questions. I like someone who, in a sense, keeps it real from a city standpoint. I think something that, I always say, we know now Line Bike is the cool kid in town, to your point, right? But let's not forget that at some point, Segway was the cool kid in town too, right? And so where are all the Segways now? Some of the conversations we're having about Line Bike, we had about Segway. And so to your point is, cities can't jump and be blinded by the light, right? And take the next cool thing and try to partner with it. But that doesn't mean that we can't partner with folks to try something new. The bike share program being an example of that, but another example is the free trolley again. That started off as a pilot program, and it's become the most successful route in the entire bus system. And so if we didn't try that, we wouldn't have found that it is a successful program. There is a demand for it. And one of the things that makes me the happiest is after work, I take that to the BART station, and you see it filled with all sorts of people, from service workers to folks that are shopping to students. And one of the most happiest things I saw also is outside of the Shaylands district, there's a school, and I saw some folks getting on Line bikes with helmets. And I asked them simply, if it wasn't for this, how would you have gotten here? And they said, my parents would have dropped me off. And so it's a little too early to tell, especially with the Line Bike. But part of it is narrative and hearing folks' story about how these programs have helped their day-to life. But a lot of it is quantitative information too. And so that data is something that we're working with Line Bike and our partners to obtain, because we update our bicycle master plan about every 5 to 8 years, right? And ours currently in the city is from about 2011. But just to give you an example, the word bike share does not appear in our bicycle master plan for the city. And so I did a control find for it, by the way. And so what that tells me is that mobility moves at such a fast pace that it may be to the city's benefit to partner with these new programs to find new information about our riders, because I'd like to know more frequently than every 5 to 8 years, where are folks riding? Why are they riding there? Where are they coming from? How far are they going? And to be honest, partnerships with Line Bike is how we obtain that data more efficiently. And so I won't shy away from those partnerships and trying something different, because at the end of the day, it's about transportation choice and allowing folks to have that option to take an alternative mode of transportation choice.
Well, that was a really good way to end things. Well, I want to be mindful of time, and I know some panelists, they have other commitments I know that they have to go to. So I will end the Q&A here, but I wanted to say that, I'll be around, and I have business cards. Margot has business cards, so feel free to contact me. And I think some panelists also brought cards as well. So if you want to contact them, feel free to, and I'm sure we'll have another way. So this is towards the end. I really encourage you to walk around, look at the posters, and fill out the surveys. They really help the city out, getting feedback about our presentations and how well we're doing. And at the back, there's a ton of resources and information. So please feel free to take them. And lastly, I really wanted to give a round of applause to the panelists. And so thank you so much, and thank you, Margot, and thank you all for being here and making this event happen. So again, this is Affordable Housing Week, so I encourage you to take a calendar and see what other events there are. Thank you.